All right, guys, welcome back to Underground Science. In this video, we'll be talking about C5 through C9 deficiency. Okay, so let's go and get started. So remember the complement system, right? Remember that the complement system is part of, right, our innate immune system, right? We talked about each different type, our classical alternative, right? Our classical alternative and our lectin pathways in our previous videos, so go check those out, right? But our complement system overall, as a basic overview, is important for innate immune system. Okay. And remember, another important thing for another important aspect of the complement system that we should talk about is it's really good at opsonizing pathogens, right? So remember things like when we get C3b formation, right? Remember that can directly bind onto pathogens, and then that can help your immune cells, right? Your immune cells to come and phagocytose and destroy the pathogen. Okay, so that's what I mean by your complement system enhances the ability to opsonize pathogens. And of course, we know that C3a and C5a enhances inflammation and attracts white blood cells. So that's another important factor of the complement system, right? Aspect of it. And then, of course, we know that later on, what happens is eventually in the complement system, you get formation of C5b, and then you form, and then that binds to C6. Remember, we talked about this cascade with C7, C8, and C9. You get all of these complements bound together that forms the membrane attack complex. Okay, that's the eventual result of the complement system. And this is really important for lysing bacteria, remember, or lysing pathogens. So if you have a pathogen here, right, it's a pretty big pathogen. And the membrane attack complex, what it does is it forms a pore in the pathogen, right? So this is our membrane attack complex, and this creates an opening between the inside environment of the pathogen and the outside environment of the pathogen. And things like water can flow in and lead to lysis and destruction of the pathogen. So the membrane attack complex is really important. And as we know, it's really important for fighting off certain bacteria like Neisseria bacteria. Okay. So let's go and write that down. That's an important thing to know because that's what this video is based on. Or that's why C5 through C9 deficiency can lead to increased Neisseria infections. So the membrane attack complex, right, is really important for fighting off Neisseria, the Neisseria bacteria, right? Those being Neisseria meningitidis, right, which is the main pathogen we should keep in mind, and also those who are deficient in C5 through C9, you also have an increased risk of Neisseria gonorrhea infections too, okay? But the more severe one, right, that we should actually keep in mind is meningitis, all right? So, so if you're deficient in C5 through C9, right, then you can't form the membrane attack complex. If you can't form the membrane attack complex, it turns out the membrane attack complex is really vital to fighting off Neisseria. But if you can't form that, then you can't fight off Neisseria and kill the Neisseria bacteria. So you can get increased infection from Neisseria meningitidis and Neisseria gonorrhea. Okay? Because remember, Neisseria has a thin outer membrane, so it's really vulnerable to the membrane attack complex. But if you don't have the membrane attack complex, so you're deficient in C5 through C9, then the Neisseria bacteria can't get destroyed properly, right? And that can lead to increased infection from meningitis and gonorrhea, Neisseria meningitidis and Neisseria gonorrhea. Okay, so that's basically it. Okay, so remember that you're gonna, so you're the beginning works fine, right? The beginning of the complement system. So you would see normal levels of your complement proteins like C1, C4, C3, C2, right? So those would be normal. So you would have, let's write this down. So you would have, if you were to do labs and test, right? Tests, you would see normal C3 and C4 levels. Because the problem isn't there. The problem is C5 through C9 deficiency. But if you did a CH50 test, which basically is testing your overall complement levels, that would obviously be low or absent because you're deficient in C5 through C9, right? So why is low or absent? Because you're deficient in C5 through C9. Okay. So if you your C5 to C9 levels would be lower absent, and that would lead to lower absent CH50 because CH50 is testing your overall complement levels, right? So low CH50 would mean complement deficiency, all right? And then of course we know that would mean that you're increased risk of getting Neisseria meningitidis and Neisseria gonorrhea infections. So of course for these patients you would want to vaccinate, right? You would want to vaccinate. So you would want to give the meningococcal vaccine so you can generate antibodies against Neisseria meningitidis, right? So you would have antibodies against Neisseria meningitidis, okay? And that's basically the important things to know about C5 through C9 deficiency, puts you at increased risk for recurrent infections due to Neisseria, all right? And that's basically it for this video. So I hope this video wasn't too confusing. I hope it made a little bit of sense. I hope it helped a little bit. And thank you guys for watching. See you guys in my future videos.